temple area, and I know you've got partial sensation return, but based on how you got that sensation back, whether it's this nerve regenerating or these taking over, you may or may not have lost the sensation which you gained already. Right. But we're going to go back just to the old scar. What happened to the mirror here? Let me give you the mirror again, the mirror again. Take the mirror a second. And the incision is going to go from about here to here on each side. And I'm just going to elevate this. And since your brows are painted on, it won't be an issue. But you notice it's also going to help the crow's feet out there. There you go. And so the same thing on this side. You get a few more wrinkles on the right side of your face and the left for whatever reason. You must be a passenger in a car driving all the time. Anyway, so we're going to take this out, and there'll be some stitches here and there'll be some staples here. You've been through that before. So then I'm going to the upper eyelid, and I'm going to take out, as I showed you a few minutes ago, let me get my little forceps here. I'm going to be taking out a little skin out here, very little here, very little here, but I'm going to take out that little bit of fat that you got there so that you don't have that bulge right there. It's about the same on both sides. Okay. With the eyelids, upper eyelids, a little black and blueness, but usually nothing more than that. Now in the lower eyelids, we're going to make an incision right underneath that lash line, and we're going to come out a little bit here. And when I grab this, I'm grabbing skin and muscle. Any place in the body, things have to move fast. The skin and muscle together, and obviously the blink is a very fast thing. Now, you've got a little bit of fat in your lower lids, more on your left side than on your right. And I'm not going to take that fat out. I'm going to release the orbital septum, which separates the muscle from the fat of the orbit. The fat of the orbit is basically a shock absorber. You know, you walk down the street and you can hit your feet hard, and the image doesn't go like this every time. It's an incredible shock absorber. It's probably the best one in the world. But I don't want to take that fat out, but I want to move it down over that rim so we get rid of that sulcus right there. And we'll stitch a little bit of that in there. And then we'll take out the extra skin. Now, because I don't want you lying in bed, looking down over your toes and having your lid pulled down this way, I'm going to put in a thing called a frost stitch. When you wake up, you're going to have your lower lid's going to be pulled up. You'll still be able to see, but I'll have it taped to your forehead. Okay. So on Friday morning, when I take off your dressings, I will take out that frost suture. But after that, then, when you read or watch television, I want you looking straight ahead. I don't want you looking down at your, lying in bed watching everything down there. Okay. Because you'll pull it down and it can heal down there, and then you can get we get a lower lid lag, you can pull down like this. And I'm going to start you after surgery on a couple exercises. One of them is like this. Look at my finger. You're driving a car, and the sun is right here, and between the sun and you is a car, and you got to see the car. So you got to squint as tight as you can, but still see that car, because you can't let the sun bother you. See what I'm saying? And you hold it for 15 seconds. 1, 1,000, 2, 1,000. Squinting, tight, and you relax. You do it again, 15 seconds. Stop. Do it again, 15 seconds. You're going to do that 3 times every hour while you're awake.
That's all?
Yeah, 3. You can do it 4, 5, 6, 7 times a day. But you don't have to wake. My point is, you don't have to set the alarm and wake up and do it during the night. Okay, so when you're awake, you're going to be doing that 3, 4 times every hour, squinting like that. Now, problems with the lower eyelid. I've never seen a case of infection of the lower eyelid. It could occur, but that's highly likely. Bleeding is a potential problem, but again, a very rare issue. What I'm more concerned about is taking out too much skin and getting what we call an ectropion. So I'm very conservative about how much skin. I would much rather you come back and say, can we take out a little more skin? Than I would have you come back and say, what are we going to do about this?
No, we don't want
So I'm very conservative. Actually, I haven't had to do either. I've never had an ectropion. The biggest concern, though, is taking out too much skin laterally to get a little bit of lid lag down this part to pull down. So we're going to be very careful about taking out too much skin in you. There are, in the world's medical literature, some cases of loss of vision in an eye following a blepharoplasty. I've never seen one. I don't want to see one. I'm not going to start with you. But has it been reported? Yes. I think most of them are due to the way that doctors used to anesthetize the lower lid, and they get some bleeding back in the eye and they couldn't stop it. And it would push on the globe. But we're going to be very careful. It's one of the reasons I always do my facelifts in the hospital. Lastly, we're going to do your facelift. Now, on your facelift, I'm going to make 3 incisions. One of them is going to be beneath here. And I'm going down and get these 2 muscles. These are, that's not just skin, there's a muscle there.
Right.
And I'm going to take the left one, this one, the left one, and pull to the right. I'm going to take the right one and pull to the left. Over that, and it's going to form a hammock. and I'm going to pull it back this way. Then you don't have any fat underneath here, so that's not an issue. Now turn your head towards me. On the face, I'm going to make an incision around your sideburns, back this way, behind the tragus, back out around the lobule, back up into your hand. The same thing on both sides. And I'm going to undermine all this skin. I'm going to grab the cheek skin and I'm going to pull it up and give it a hike. When I do this, it distorts things, but it won't distort in your face. And the point of it is that you're going to put some of the cheek fat back in the cheeks. Now, this muscle is associated with the superficial muscles of your face. Your facial muscles, as you smile and frown and all the facial expression, are in 2 layers. And this is part of the superficial one, and we call it the SMAS, superficial muscular aponeurotic system. And I'm going to undermine part of that, and I'm going to hike that muscle straight up, basically, maybe a little bit back, because that's further going to improve your neck. But the skin pull is basically from your chin to the tragus, this way. And basically, we don't put a lot of tension on. We're just going to sort of lay that in with a little bit of tension, but you can see it's going to get rid of the jowls and pull that up. So there'll be stitches behind the tragus and behind the ear that'll go away on their own. There's going to be some silk stitches here and here that we'll take out. There'll be a few staples back here. So what kind of problems? Infection. I've not ever seen infection there. Since very early in my career, Gallup didn't take her antibiotics. And that's been 30 more years ago. Bleeding. Bleeding is a potential issue. That's why we have the drains there, because there's always a little bit of bleeding, and you have those drains with the suction on them. If you had a major bleed, we just have to go back to the operating room and take care of it. We've been back to the operating room one extra time. We're not going to do that again, okay? All right, so we're not going to do that. And you make sure you take your high blood pressure medicine tonight, your Hyzar, and you do take it at night, don't you? The Hyzar.
I think that's what.
Yeah. So take that tonight as usual. Then.
At what point do you do the septum? Is that like last?
Oh, excuse me. I'm going to do that before I do the facelift. I'm going to make a little teeny incision there and just go cut off that little bit. You're just concerned about that little piece. Look in the mirror a second. You're concerned about that piece right there, aren't you? Okay, fine.
That piece.
And it'll just be a very simple thing. It'll just be a couple stitches there. I'll just
Self-dissolving?
Probably. Yeah, it probably will be. And then I'll do the face. This will be after the lower eyelid. Bleeding, I talked about. Infection. Your skin's going to be kind of numb in this area. Just like everything else, but it comes back. Usually it comes back in around 6-8 months, but I've had a rare patient take as long as a year. So hopefully that won't be an issue. The biggest issue we're always concerned about is a nerve injury. The facial nerve, which controls all the muscles of facial expression, comes out of the skull about here, comes beneath the ear and divides into 7, 8, 9 branches. And that nerve travels between those 2 layers of the muscle. And I don't see it, but it travels with the blood vessel. So you got a little blood vessel that's bleeding. So I go in there and cauterize it, and I see something jump, and I know, rats. I just cauterized the nerve. And then something doesn't work for a while. But that's not going to happen. And I'm not going to put my foot behind your head and pull as tight as I can. I don't want you to look distorted. I don't want you to look like you're in a wind tunnel. So I just want to get rid of the excess and pull it up nicely. Okay? Now, I'm going to take the dressings off on Friday. I do not want you showering Friday, but on Saturday you can shower and wash your hair. Okay? You maybe, if you had a chance, you went by a drugstore tonight, it would be a bad idea to get some Johnson & Johnson baby shampoo, because one of the problems is after your eyelids, there's sometimes a little tendency to get soap in your eyes. And some baby shampoo, no tears.
Yeah.
Okay.
But I can shampoo my hair on Saturday.
Yep.
Just leave it alone Friday.
Yep.
Grunge out.
Yep.
Grunge out. Okay.
All right. Other questions? That's about it.
Why are you such a deer?
because it's I mean, like the car.
You see why I chose him?
In the headlights, there I am, the deer in the headlights.